Hi, my name's Carrie. I'm a nurse practitioner student, and I'm going to be completing your musculoskeletal exam today. Can I please have your name and your date of birth?
My name is Dimitri Gotonaga, date of birth February 3rd, 1988.
Okay. And then I just wanted to let you know if at any point during this exam, if you have any pain, tenderness, or if you feel that you need a break, just let me know.
Okay.
Okay. So then, continuing on with some orientation questions, can you please tell me what city you're in?
I'm in Las Vegas.
And where are you right now?
I am at home.
Okay, and what year is it?
It's 2025.
Okay, thank you. I'm just going to do some hand hygiene really quick before the assessment. And then I'm just going to state my general survey. So Dimitri is a healthy appearing 37-year-old male. He is calm, cooperative. He's sitting in an upright posture. He is alert and oriented ×3. Skin appears to be appropriate for ethnicity, and there's no acute distress noted at this time. So Dimitri, we're going to start off with a test for your rotator cuff. So if you wouldn't mind coming up just a little bit. First, I was just going to explain parts of your rotator cuff. So first you have the supraspinatus, then you have the infraspinatus, you have the teres minor, and then a little bit more internally you have the subscapular. So for this test, we're going to start off with the Apley scratch test. So that just looks like you reaching around and scratching, and same on the other side, reach around and scratch. Perfect. Awesome. Any pain or tenderness with that movement?
No pain.
Okay, and that movement appears fluid, so that test would be negative. So next we're going to do the drop arm test. That looks exactly how it sounds. So you're just going to lift your arm straight up in the air in a slow and controlled movement. I want you to just lower it slowly down to the top of your thigh, and then again repeating that on the other side. Awesome. It appears that Dimitri has, again, he's maintaining control with fluid movement. That test would be negative. Any pain there?
No pain.
Okay. If there were any problems with the rotator cuff, the patient would have trouble typically going above their shoulder. Their arm might just drop. They're not going to have such slow and controlled movement like that. And then, so the next test that we're going to be doing is for carpal tunnel. So carpal tunnel is testing those medial nerves that typically affect your first 3 fingers and half of your ring finger. Typically with a numbness or tingling sensation. So the first movement that I'm going to have you do is called the Phelan's test. That looks like just a reverse prayer. You would hold this position for 60 seconds. At the end of the 60 seconds, I would ask you if you have any numbness or tingling.
No numbness, no tingling.
Okay. So then our next test is called the Tennell's test. So right above these medial nerves, you can relax. I'm just going to tap. Any numbness, tingling in those fingers?
No.
Okay. And then on the other side, go ahead and relax again. Any numbness, tingling in those fingers?
No.
Okay. So then next we're going to move on to checking your spine. Yep, perfect. If you wouldn't mind just facing that wall. So first we're going to visually inspect, looking for any obvious abnormalities, any obvious asymmetry. We're going to check for scapular winging. We're going to check the iliac crest to ensure that those appear symmetric. Looking at the skin as a whole, ensuring there's no bruising, ecchymosis, noting trauma, any just obvious deformity. And it appears visually intact. So moving on to palpation, we're going to be starting at the C-spine, and we're going to be palpating the vertebra all the way down. Any pain or tenderness with this?
No.
Okay. And then we're going to be palpating those muscles along the spine, the paravertebral muscles. So this time we're going to be looking for any pain, tenderness, or muscle spasms. And then just please let me know if at any point you feel any pain. Okay. So then we would palpate the sacral iliac joints as well. Those appear to be kind of just like the dimples in the low back. Next, Dimitru, I'm going to have you bend over and kind of just let your arms hang. Perfect. So this is checking for scoliosis. So we're ensuring straight curvature of the spine. Again, checking for scapular winging. And it appears symmetric. Go ahead and stand. Then, Dimitri, I'm going to have you please lay flat on your back. Next, we're going to be doing a test for radiculopathy of the back. So for this one, laying flat, being nice and relaxed, I'm going to lift your leg about, oops, my camera just shut off. Okay, I want to make sure I didn't lose the video. Okay, so about 60 degrees, we're going to lift your leg. Any pain?
No.
Okay, and then we're going to dorsiflex. Any pain?
No.
Okay, and then with the other foot, any pain?
No.
Okay, and then we're going to dorsiflex.
No pain.
Okay, awesome. So that test would be negative. So next we're going to move on to the ligaments of the knee. First, starting off with the valgus test. So the valgus test tests our medial collateral ligaments, also known as our MCL. So for this one, we're going to have you lift your legs straight. Perfect, keeping. So then lift the legs straight. We're going to be putting the hand slightly above the knee. And then the other hand applies outside pressure. Okay. Any pain with that?
No.
Okay, perfect. And then we're going to do the varus test. That one tests the LCL, the lateral collateral ligament. So that one is a similar movement, just kind of opposite, if that makes sense. So I'll help you do that one. So for this one, we're going to, again, lift your legs straight. And then I'm going to put my hand on the inside, just above the knee. And then I'm going to be pushing the ankle inwards, towards the medium. Any pain with that?
No.
Perfect. So then we're going to do the other leg. Again, starting off with the valgus, you're going to lift your leg straight. I'm going to put my hand slightly above the knee. The other hand is going to apply outer pressure. Perfect. Any pain?
No. No pain.
And then my camera's going to shut off again. Okay. And then, sorry. And then the varus, testing the LCL. So you're going to be lifting your leg straight. And then putting the hand just above the knee, I'm going to push the ankle inwards towards the medium. Any pain with that?
No. No pain.
Perfect. Okay. And then we are going to move on to the anterior and posterior drawer test. So this one is testing the ACL and the PCL ligament. So for this one, you're going to still continue to lay flat. I'm going to have you bend your knees, both of them, just like that. Perfect. And then, Dimitri, I'm actually going to sit on your foot. And for this one, so I'm going to place my thumbs over the tibia fibia, and then I'm just going to do quick pushing and then pulling movements. So I'm going to push and pull. Okay, so that test is negative as there's no movement involved, no additional movement involved. Typically, if there's an injury with one of these ligaments that's supporting your tibia, you would notice additional movement there, and that would be positive. Same with the varus and the valgus. The important thing there is you want to see no movement. So that test is negative for you as well. Then I would do the same thing on the other side. So again, sitting on the foot, applying my thumbs directly over that tibia fibia, and then push and then pull back. Okay. Next is going to be the McMurray test. That one rules out any meniscus injury or tears. So for this one, I'm going to have you flex your knee just like this, and then I'm going to internally rotate your heel. Oh, thanks. Not sure why this doesn't stay on. Okay. So again, for the McMurray test, I'm going to have you flex your knee. I'm going to internally rotate your heel, and then I'm going to have you push your knee straight into my hand, if that makes sense. I'm going to go back and then straight, back and then straight, back and then straight. So this is more of a varus movement. So then we're going to do more of a valgus movement, which is similar, but we're going to externally rotate the heel. And then again. So I don't feel any clicking, popping, and no reported pain, correct?
Correct.
Okay, so that test would be negative, but we're going to do the same thing on the other side. So again, we're going to flex the knee. We're going to do kind of more of that varus movement first. So we're going to internally rotate the heel, and then go ahead and put pressure against my hand. Okay, and then I'm going to externally rotate the heel, doing more of a valgus movement, and then I'm pushing the knee straight against the hand. Perfect. Okay, no clicking, popping, or pain, so that test would be negative. Okay, so then we're going to move on to our deep tendon reflexes. So Dimitri, if I could have you just sit. Thank you. First off, I just wanted to talk about the grading of this. So the scale is from 0 to 5. The 0 would be no movement at all, no reflex at all. The 1+ would just be a very diminished movement. 2+ is would be expected and normal finding. 3+ would be brisk, and 4+ would be hyperactive. So first we're going to start out with the bicep deep tendon reflex. So for this one, for all of these, it's really important that you just stay as relaxed as you can. So we're just going to kind of loosen up your arm here. I'm going to find that bicep ligament. I'm going to apply pressure so that ligament is taut, placing my thumb directly over. Good job, just stay nice and relaxed. And then we're going to tap. So I would say that's about a 1+ on that side. Then same on the next one, ensuring nice and relaxed, finding that ligament, and then we're gonna, I would say about a 1+ on that side as well. This is testing the C5 and the C6 nerve. Next is going to be the tricep deep tendon reflex, which is testing the C6 and C7 nerve. So for this one, we're going to put your elbow at 90 degrees. I'm going to find the tendon just above the elbow and nice and relaxed. And we're going to tap. About a 1+ there. We're going to come on this other side. Nice and relaxed. Find this ligament and tap. Okay. I'd say about a 2+ on that side. And then we're going to test the brachioradialis. So this is testing the C5 and C6. So for this one, I'm going to find my ligament kind of just above the thumb right here, on the forearm a little bit. Grab the, relax, the ligament right here, and we're looking for that upward movement. Okay, about a 2+. And then we're going to go here and, okay, 2+ there as well. So next we're going to check the patella. It's a little bit hard because our feet are not dangling. So for this one, your knees would typically be dangling, and the knees would be a little bit out from the exam table. And then this is testing for the L2, L3, and L4 nerves. So right below that kneecap, you would find your tendon and here. Of course, we're not going to get a reflex because our knees are not hanging. But here, right there. Perfect. Okay. And then we're going to check our Achilles. So for this one, can I see the feet? Perfect. Oh, you're okay. So for this one, I'm going to kind of dorsiflex just a little bit and pull outward. And then I'm going to hit right behind on that Achilles tendon, looking for that movement. So 1 plus there. Then I'm going to come on this side. Just relax, and then we're going to dorsiflex and pull outward just slightly. 1 plus there as well. Okay. Thank you for participating in my musculoskeletal exam. And that's all I have for you. You did great. And then I'm going to do my range of motion assessment on myself. So, for the range of motion, first I was going to talk about grading. So range of motion gets graded on a scale of 0 to 5. 0 would be no movement. 1 would be slight contraction. 2 would be active range of motion with gravity not included. 3 would be active range of motion with gravity. 4 would be active range of motion against some resistance. And then 5 would be full resistance, full strength. So we grade it kind of in a fraction. So the top number would be what our finding is, and the bottom number would be 5, which is normal. So it's always going to be our finding over normal, which is 5. So starting with the fingers, so range of motion, I'm going to do flexion, extension, adduction, which is together, abduction apart. And then I was going to do wrists, so extension, flexion, radial, and ulnar. Then elbows, we're going to do flexion, extension, supination, and pronation. And then we're going to do shoulder, so adduction, abduction, flexion, extension, and then external and internal. So then neck, we're going to do extension, flexion, rotate to the left, rotate to the right, lateral bend to the left, lateral bend to the right. And then for spine, we're going to do flexion, extension, and then we're going to do left and right, lateral bend to the left, lateral bend to the right. For our hips, we are going to do flexion, extension. We're going to do adduction and abduction. And then we're going to externally rotate and externally rotate. And then for the knee, flexion, extension. And then for the ankle, let me put this down here. So for the ankle, we're gonna Dorsiflex, plantar flex, inversion, exversion. And then for the toes, we're gonna do flexion and extension.